Hey, what's up everybody? Today we are talking about how your therapist sees you. Now, this video was brought on by a throwaway comment that somebody made on one of my shorts, but I thought it was really interesting that they called this out and what they had to say about the topic, and so we're going to dive into that today. So the original comment was, patients, not clients. So this was a short where I was talking about clients in some way, and so I guess they took exception to the idea that I would call the people that I work with clients instead of patients. So this is their explanation. When I'm a client, I'm here to buy. As a patient, I'm here to be honest and seek help. And the fact that so many therapists say clients reveals how they see us, and that's what we're going to talk about today. Find therapists who say patients, not clients. So they are very set on the idea that what somebody calls you is very telling of how they see you and the kind of relationship you all are going to have. I agree with them on that. True advice based on many experiences. I'm not here to dispute their experiences. I'm sure they might have had somebody who maybe called them clients and maybe didn't treat them the best. But I'm here to make an argument for why I do call the people I work with clients and not patients. So before we dive into it, please do like and subscribe. It helps the channel to grow. And let's talk about this interesting issue. So let's start by talking about definitions here. In terms of client versus patient, I think a lot of times we consider them interchangeable. We know that what we're talking about is somebody who goes to see a therapist for counseling services. But there is a distinction based on the definitions and some of the connotations associated with that. And that's what I'm going to talk about today and why I choose to use the word client instead of patient. So we'll start by going to dictionary.com, and the definition that they have for client is a person or group that uses the professional advice or services of a lawyer, accountant, advertising agency, architect, etc. I don't know how they decide on those particular professions, but this is the key part. A person or group that uses the professional advice or services of, let's say, a professional. And let's contrast that with the definition of a patient according to dictionary.com. A person who is under medical care or treatment. So let me make the argument against calling people patients first. So philosophically, the way I see counseling is a partnership or a collaboration between myself and the client. I bring certain expertise and training to this process. I bring non-judgmental listening, unconditional positive regard, and some of the skills that I have to be able to help them organize their thoughts, sort through their feelings, and decide on a course of action that will most benefit them going forward. What they bring is their expertise on their own story, their native skills, the patterns that they developed, their willingness to work and to share and discuss what's going on with them, their thoughts and their inner lives. And together we use that to create positive change in their lives. Now, the problem that I have with the word patient is, first of all, that it comes out of the medical model. And a lot of times what that connotes is somebody who is, the key word here is under medical care or treatment. I am the expert providing care for you. You do what I tell you to do because that is the best way for you to be treated for the condition that you are dealing with. So this absolutely makes more sense when it comes to doctors and certain other medical care where I don't know what the right medication is for me to take. And so I am under the medical care of a doctor or a physician who has that expertise, who prescribes the medication for the infection that I have. And then I just followed instructions and things work out just fine. But the implication here is a power dynamic between unequal people. What I bring to the doctor is not nearly as valuable as what the doctor brings to me. And so in that sense, it's not a collaboration. Now, I know that some doctors are making an intentional choice to move towards a more collaborative approach when it comes to certain treatments. But if we're talking about just a simple infection, I am relying on their expertise, their knowledge, them telling me what I need to do, what medication to get, what prescription to fill, that kind of thing. And so this puts the doctor in the role of the expert and me as the patient receiving the care. Again, like I said, I don't have a problem with the word patient specifically. I am totally fine being a patient in medical situations, but I think the counseling relationship is different, and this is why. Now, the reason that I choose to use the word client instead of patient is because of the implications about the power dynamic that I mentioned previously. When you have a client, you have a paying customer who is seeking advice and services from you. And built into that are certain rights and privileges. When I think about a contractor and a client relationship, there is a give and take, there is negotiation, there is collaboration between someone who has a vision and someone who can help carry that out. I am providing a service for you, And so my disagreement with the original comment that the person mentioned was actually that I think there is more of an unequal power dynamic when it comes to a patient and a doctor terminology compared to client terminology. And so, yeah, you can make the argument that, yes, if you see them as clients, you see them as a source of income. But I think that's just putting it out there that, yes, I am getting paid for these services. I think nobody's going to begrudge me that, or a doctor being paid for their services. But the idea of being a client, in my mind, actually affords you more privilege, more rights. You are on equal footing with your contractor, if you want to call them that. You're on equal footing with your therapist to be able to say, hey, this doesn't match my experience. The tools that you're using aren't working for me. Can we reevaluate? Can we see if there might be another approach that might better work? And that definitely does speak to a more egalitarian relationship between client and counselor, because I'm not the expert on everything associated with what you are particularly experiencing. While I may have done research, done schooling, training, continuing education on this particular condition that you're struggling with, I am not the expert on how your unique circumstances and environment and patterns of behavior and thinking happen to influence and impact how that manifests in your life. And so your contributions in terms of sharing your thoughts, your feelings, the ways that you typically cope and respond to these difficulties are just as valuable in informing the treatment as my expertise in helping you get through this challenge. It also speaks to the possibility of, if you don't like the advice, I guess. I don't like to say that I give advice because I normally don't. My clients will attest to that. They get tired of me turning questions back on them whenever they ask me something. What that does connote about the advice that I might give, though, is that it is not expert opinion. It is not non-negotiable. It is absolutely something that you can push back on, and you have rights to do so as a client, less so as a patient. Like I said, the medical model is moving towards a more collaborative space, but I can't just say to a doctor, oh, I don't think this particular medication is going to work. How about you prescribe me this one instead? That would definitely be a problem within a patient-doctor relationship. I can see the objection being that, oh, if you see people as clients, then you just see them as a source of income. You're going to treat them less as people and have it be more of a transactional thing. And so some of that might be a result of my training and kind of my native approach to counseling, but I see you being a client as affording you more of those protections that, yes, because you are my client, I should afford you a certain respect. I should afford you a certain level of service, a standard of care that you would be right to call me on or fire me if I am not meeting that particular standard. And so some of that comes down to how I view the profession as well, that I have professional pride in the services that I provide, and that you have a right to push back on that or call me on it if I'm not meeting, again, that standard of care that you are deserving of as my client. And of course, because I am a counselor, we adhere to a code of ethics, and so that is considered one of our standards of care. And the American Counseling Associations, they at least do specify in the language of their code of ethics that people are considered clients. Nowhere does the word patient appear, even if it's not stated explicitly. The fact that they use the terminology of client throughout the document indicates this is how we speak of the people who receive our services. So those are some of my thoughts when it comes to this topic. I can get that the person was influenced by maybe somebody who used that language kind of intentionally and had a poor reflection on what it meant to be a client, and they would rather be a patient. So I get that. What I would push back on is that the language is that revealing, because obviously I'm choosing to use the language of client, and I maybe have a very different interpretation of what that means and what that implies. But I will say that the distinction from the medical model is important to take note of. The implications about the power dynamic and about the inherent rights and privileges afforded to you as a client versus as a patient make a big difference in the way that we're seeing and interpreting this language, as well as just what the ACA, the American Counseling Association, has chosen as its terminology in terms of using the word client instead of patient. But of course, I have no ill will towards this person. If you do happen to see this video, I would love to hear more of your story about what was going on, what made you feel like somebody using the language of client is actually a red flag. And again, this is a community that I hope fosters discussion, and so this is not me firing back at somebody. It's just to clarify why I choose to use this language and for us to have a discussion about that. So let me know, which kind of terminology do you prefer, whether it's the patient or client, and what you think that implies about the way that you see counseling in your own therapy process. So thank you all so much for watching. I'll see you all next time.